A former journalist, Harvard trained management consultant, and hospital executive, Cynthia Hayes is the author of The Big Ordeal: Understanding and Managing the Psychological Turmoil of Cancer. Since recovering from her own ordeal, she has helped raise awareness of the shared emotional experience of cancer, the physical drivers behind it, and how to cope with it all. Cynthia, thank you so much for coming on and sharing your story.
Well, thank you so much for having me, Andrea. It's a pleasure to be here.
And a little disclaimer, so I have met Cynthia in person at ASCO about 6 weeks or so ago. And by the way, please tell me you didn't get COVID at ASCO because
I
I
did
did.
not get COVID. I am
Oh,
so
thank
sorry to
goodness.
hear you did. Oh, I hope it wasn't too
So many
bad.
people did. Yeah, so many people did. But it's not about me, it's about you. So so Cynthia, take us back to the beginning. You definitely have a very interesting and prestigious bio. So it sounds like you had a lot going on. So take us back to the beginning of that cancer journey. What was that like and how did it start? Did you have symptoms?
Well, it was really interesting because I had just retired from a very big job, and I was going to write the great American novel. And it was summer, and my daughter had graduated from college, and she was home for the summer, and we were having fun. And I wasn't focused on maintaining my regular health checkup schedule or whatever. But my gy- but my gynecologist was, and she called and
Good.
said, "Look, you haven't been here in a while. It's time to schedule an appointment." And I said, "Sort of, yeah, I'll do that later." And she said, "No, let's schedule it now." So we scheduled it, and it was scheduled for September. And I went in and, I had no complaints other than, well, maybe a little fatigue, but at age 57, who isn't a little tired? So it wasn't anything. And She went through all of the, usual exams and tests, and everything seemed fine. And then a week later, I'm walking down the street with my daughter, and we were on a mission. We were going out that night. We were getting our hair done and our nails done, and we were all excited. And we were on our way to the manicurist, and cell phone rings, and it's the gynecologist's office. And I assume it's somebody calling about, the insurance didn't go through, or there's an extra charge, or whatever. And so I pick up nonchalantly, and it's my doctor, and she says, "Cynthia, you flunked your pap smear. There are some blah blah cells." I was like, "How do you flunk a
That's
pap test?"
awesome. That's awesome.
So she said there are blah blah cells, and you need to come back in for more testing and call the office, and we'll schedule it. And I just sort of shrugged it off and said, "Sure, sure,
Prior to
sure."
that, had you ever had an irregular pap smear in your life?
Never in my life.
Wow.
Never in
Okay.
my life. I have always been incredibly healthy and incredibly an easy patient for all of my doctors. Um, but she hung up quickly. She was in the middle of a delivery, and she said, "Call the office, schedule this." And by the time I got to the manicurist's, plopped my feet in the bucket and was sitting there. I had 5 minutes with the phone. Called the office, and the office was closed already. I thought, that's a little odd. And then I started Googling what the blah 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 cells were that she mentioned, and it was like, oh my God, I'm going to die of cancer, because the cells that they found were the early markers of a very aggressive type of endometrial cancer. And I just went into instant panic mode, and the office was closed the next day, even though it was a Friday, because I mean, you can't make this stuff up. The Pope was in town, and the Pope was
No.
visiting somebody across the street from my gynecologist's office. So they had to close because they were going to be cordoned
Wow.
off all day long. So I had to wait until Monday to schedule the appointment. And so it was literally 4 days of just agony, of not being able to talk to anybody, not knowing what was going on, and being fearful about what the test was going to show, and convinced
Now,
that I was going to die of cancer.
your adult daughter was right there with you. Did you tell her
She
anything?
was. No. No, I did not. I did not say a word. I did tell my husband. So my adult daughter was there with us, but she was also preparing to take the law school entrance exams, and
Oh, okay.
I just didn't want to distract her. She was really focused. She was studying hard, and this was news she just didn't need to hear, and it wasn't confirmed news,
Right. You
so
didn't even know what
didn't even
you were
know for
dealing
sure.
with.
She did, however, take me for the endometrial biopsy, which, wow, don't get that done without anesthesia. Incredibly painful procedure, and
Wait, wait,
uh,
wait. Why did you not have anesthesia?
nobody told me I needed it. A gynecologist said,
Isn't
"Come
that a
on in,
decision that
let's
they
just do that.
make?
Let's just do that endometrial biopsy," which I had had my
My
babies a long
God.
time ago. That cervix had not been open; it was painful. But that was the next step in the process, and we had to wait until Tuesday to get that test done, and then the following Monday, the results of the test, which did in fact confirm that it was cancer. And by the time I got the phone call from the doctor saying yes, it's cancer, it was a Monday morning. My daughter had taken the LSATs, and we didn't have to worry about that anymore. She had then gone off for a long weekend and was not back yet by the time we knew. So couldn't tell her yet. Couldn't tell my son because I didn't want to tell him without telling her at the same time.
Mhm. That's fair, yeah.
And I couldn't even tell my husband because at the moment I got the news, he was at the dentist's office with a mouthful of cotton. It was just an absurd situation. And of course, I'm laughing about it now. But at the time, I was in so much turmoil. It was such a panic.
Sure.
And just, I was anxious and fearful and incredibly stressed. And as I said, certain that I was going to die. This was a cancer with very low survival statistics. And yeah, I was,
And
I
what type of
was,
cancer was it specifically and what stage?
it was a serous carcinoma, endometrial serous carcinoma. And the lucky thing was that it was stage one, because it was caught on a pap smear. I didn't have any symptoms. Nothing else was going on in my body. It was just there were these few random cells caught in the pap smear. And of course, it was when I started meeting with oncologists that my anxiety levels started to come down. Particularly this one oncologist who took my hand and said, "Look, we won't know for certain until we get in there."
Right.
But this is a cancer we can deal with, and you're going to be okay, and everything's going to be fine. So just, be patient, hang in there. I know that this is a really hard piece of news to hear, but you're going to be okay. And of course, that's the surgeon I ended up choosing because he instantly brought my anxiety down, and by looking me in the eye like that, he made me feel like a human being, not
Right.
a a vessel for cancer, but a human being with a health crisis.
Before we go into your treatment, how did your children react?
Uh, well, it was hard. My son was on the West Coast, and it was very hard for him to hear the news, but also very hard for him um, to know how I was doing. And so he really wanted to be there for me, but didn't want to overdo. So he was, frequently on FaceTime, frequently texting and being supportive, but being from a distance. And my daughter just never left my side. She was, throughout the entire process, just, there for me every step of the way. She was just amazing.
Wow.
So, just amazing.
And so what was the treatment? You mentioned surgery. So tell us
Yes, I
about
had
that.
a radical hysterectomy, which meant they took everything out. Now, I wasn't using it anymore, so it was okay. But even though I had previously gone through menopause, your ovaries continue to deliver a little trickle of juice for quite a while still, and to have them surgically removed just puts a hard stop to that. So it was a tough surgery, not just because it was a physically arduous process to remove all of those pieces. But then the recovery process was quite extensive, in part because of the surgical process itself, but in part because of the hormonal changes that accompanied it. And unfortunately, they tried to do it laparoscopically, but because of where the cancer was, they were afraid they were going to disrupt the cancer. And so they ended up opening me up, which meant that I first had my belly blown up so they could get their laparoscopic instruments in there and see what was going on, and then had an open incision hip to hip before they took everything out. So I definitely had a more complicated experience than some patients, and it was painful, definitely painful. So.
Yeah, that's a big, I mean, it's a big surgery anyway. I've had a radical hysterectomy as well, because of endometriosis. I finally just threw in the towel and said I can't do it anymore. I'm
Yeah,
done.
I'm done.
And I was very scared because I was not in menopause, and I was like in perimenopause for sure, but I wasn't in menopause. And so
Hmm.
for people who don't understand, you're right. Even if you've gone through menopause but still have your ovaries, they are, giving you some estrogen. And so when you wake up from surgery, from a radical hysterectomy, you are immediately thrown into menopause and you have nothing in your body anymore giving you any estrogen.
Yep.
And it's just this immediate sort of shock to your system.
Yeah.
Mine was laparoscopic, so much
Hmm.
so that I didn't believe the surgery had happened. Like I got into a super weird argument. I get very argumentative when I wake up from anesthesia. And I was like, "You didn't do this," because I wasn't in any pain. I was like, "You didn't do that surgery. It did not happen." I didn't believe it until like a day later or whatever. But yeah, to be opened up, such a huge incision like that, that's a
Yeah.
much more
Yeah.
difficult surgery to recover from. And like you said, now your ovaries are gone. So,
Yep. Now my ovary's
yeah.
gone. And one thing that I wasn't, truly focused on, but the uterus and all of the gynecologic organs are behind the intestines. So in order to get to the gynecologic organs, sort of got to pull out that mess of spaghetti in there and then do their surgery and then shove everything back in. And the intestine is not attached to anything, so it's fine. Let's just pack it back in there, and it's got its own little sac to go in. But it gets manhandled a lot, and that leads to complications and side effects down the road.
So you have that surgery. How long was the recovery from the surgery?
I am a very physically fit and active person, and I
Yeah,
was,
definitely.
running until the 48 hours before surgery, playing
Wow,
tennis,
that's
all of that
amazing.
sort of stuff. But then after the surgery, I wasn't allowed to do anything for 3 weeks, and the first, you know, I was in the hospital for 3 nights, and then I was sort of on the couch for another 3 or 4 days, and then I was fine. I was uncomfortable, but it was fine. But the doctor said, nope, still can't do anything. So it was 3 weeks before I was allowed to really go for a walk, beyond 10 steps or whatever. And then I saw the doctor again, and he said, okay, back to full activity. You can do whatever you want to do after that 3 weeks. So, depending upon how you want to define how hard or challenging was that recovery. Um, of course, the thing was that as soon as I was recovered from that surgery, then they wanted to start me on chemotherapy. And I did 6 rounds of chemotherapy. The standard chemo for most gynecologic cancers is carboplatin and Taxol. It's a really lovely combo that will make you lose all of your hair, will make you nauseous, will make you constipated, will, all of the nasties one thinks of that come with chemo, including neuropathy and muscle aches and pains, and wipe out your red blood cells and your white blood cells, um, and further complicate your intestinal issues because
Yeah.
chemo, the way chemo is effective is that it kills off fast-growing cells. So hair follicles, those are fast-growing cells. Our hair renews itself on a regular basis. Skin, I had amazing skin because those skin cells were turning over pretty quickly. But the lining of the intestine is also one of those things that turns over pretty quickly, and so therefore those cells are dying, and that's what messes up the intestine so much.
Really? I don't think anyone's ever put it that way before with such specificity. That's
Mm.
really interesting. That explains a lot. So, how long did it take to do the 6 rounds of chemotherapy?
It was a 3-week cycle, so it was pretty much 5 months of treatment. Um,
Wow.
and the first day after treatment, so they give you lots of pre-meds along with your chemotherapy. So pre-meds included things like Benadryl, which ensures that you don't have an allergic reaction to the chemo. Does make you very sleepy, meaning that day goes by pretty quickly. Also, anti-nausea medications, so that
Yeah.
chemo is not anywhere near as hard on the body as a lot of the old movies and stories of chemo are, because of the advances in antiemetics, they call them. And then the third thing they give you is steroids, and the dexamethasone that is a part of many chemo infusions also helps the body. It makes the chemo more effective, but it also helps prevent allergic reactions or going into anaphylactic shock, or any of those other lovely things that might happen. And of course, the steroids also make you feel great. So the day of the infusion, after having had a good Benadryl nap and gotten my hit of dexamethasone, I would come home feeling wired and ready to go. And I got my treatments on a Thursday. Usually Friday, that would be the day I would organize for the weekend because I had all of this energy. And sometimes I even went to the gym on the Friday.
No,
Yeah.
really?
Yeah. 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 We were just determined to not let those red blood cells disappear. But then Saturdays and Sundays were pretty much, couch potato days. And that's when the nausea would kick in, and, um, like the worst of the chemo side effects were over the weekend. And then Monday would be the day when the last of the dexamethasone would be leaving my system. That would be the day of the emotional crash. I would always be in tears on Monday. The why me, the
Really?
why is this so, miserable? Why is this
Oh,
happening? And then Tuesday I'd wake up, it's like, oh, okay. I'm okay. I'm tired. I'm weak. I'm pathetic, but I'm okay. And then I had another 2.5 weeks to build back before they whacked me the next time. And the cycling through was really determined by how quickly your white blood cell and red blood cell counts plummeted and then recovered.
right. Yeah,
And the white blood cell count plummeting, one wouldn't necessarily notice. But the red blood cell count plummeting meant no energy. And that's why cumulatively the fatigue builds, because
right.
you never fully recover from one dose of chemo before they whack you with the next one. And so, as is relatively common, there were a couple of times when I had to have Neupogen shots. And Neupogen is a drug that stimulates the development of white blood cells and causes incredible pain in one's bone marrow, because that's where the white blood cells are generated. So all of a sudden you have these shooting pains mostly in your lower legs, but because your body is stimulating the growth of those blood cells. And then the best way to stimulate red blood cell growth was exercise, which is why I was so determined. I would go to the gym and try and push the pedals of a bike, or go, for an extended walk, trying to elevate my my heart rate enough to signal to the red blood cells, hey, get busy in there, we need more.
Did you ever receive any blood transfusions?
Never had any blood
Wow.
transfusions. Did have
Okay.
to
So,
postpone a couple of treatments because the white blood cell counts were too low, but never
right.
needed a transfusion.
I'm always so amazed how different even if you had the exact same cancer, the patient is exactly the same age, even if everything is quote unquote the same, how often different the protocols are.
Mm,
Because my sister, I gave her a Neupogen shot every day.
yeah.
Every day she
Poor
had
dear.
one.
Poor
And
dear.
yes,
That is painful.
yeah, and that was the protocol. Now that was 20 years ago and she was a teenager, but
Yeah.
that was just something that was accepted. That was the
Yeah.
norm.
Yeah.
And yeah, the bone pain was excruciating for her,
Excruciating.
especially the
Excruciating.
thinner she became.
Right.
At first I think not so much, but
Yeah.
wow.
Yeah.
And by the way, I think you're the first person to ever say something positive about steroids. So I got to throw that out there.
Oh, they make you feel so good.
Well, but see, I wasn't sure if you were being sarcastic or not, but you weren't because
No.
some people, I mean, most people I've interviewed who've had them say it was so horrible because it did make them emotional or just really angry,
Right.
super short tempered,
Super
just
short
that,
tempered. Yeah.
what do they call it? The
Road rage.
steroid road rage, right?
Yeah. Road
And
rage.
and so I just love that you made it work, that it worked for you, but you also made it work to your advantage, that it sounds like you were very methodical about it and you knew and you were able to
Well,
track.
the first couple of cycles I didn't know, and I
Right.
was surprised by my emotional volatility and the flow of symptoms. But I'm a curious person, and so I ask a lot of questions,
Good for you.
uh, and the doctors didn't always have answers for me. So I would
Right.
go, researching, and I mean, ultimately, I wrote the Big Ordeal because my doctors weren't giving me answers, and there were questions that not only I had, but that others that were going through cancer had the same questions. It's like, well, why isn't anyone giving us the answers to this? Why don't we know this in advance?
Yeah.
So,
Yeah. After the chemotherapy, were you then done?
yes, and I was not 100% certain of that until the very end, but the doctor said, we might need to do, it said originally we might need to do radiation as well, and we'll figure that out down the road. Um, and as I was researching protocols and looking at different hospitals and doctors and getting second opinions, there were two, top hospitals, one in New York and one in Houston, that they said the protocol was absolutely radiation. And radiation was internal, meaning vaginal rods that then
Oh my
would
God.
have
No.
provided the radiation right at the site of the cervix. And I was very thankful when my doctor said, no, no, I don't think we're going to need to do that,
Yeah.
Cynthia.
That sounds so
So,
awful.
yeah,
Oh my
so awful.
God.
So awful. I really feel for people
Wow.
that, need that as part of their treatment. So,
Wow.
yeah.
Oh gosh. What was your worst moment in all of it?
I think the worst moment was actually the first news, and in the absence of information,
Mm,
the mind goes to a really bad place. And part of it is that, for millennia, cancer has been a death sentence. And so that's
yeah.
what we assume when we hear the words, you've got cancer. And even though my gynecologist didn't tell me that on the phone, the information that she did share with me made it very easy for me to conclude A, that I had cancer, and B, that I was going to die. And that was just horrifying, just horrifying. Nothing that happened after that was quite as scary or difficult as what I imagined it was going to be. And that's, also I think a a problem with sort of the way we talk about cancer, or the way we don't talk about cancer, more importantly, is that the fear associated with cancer is so much greater than it needs to be. Um, but there's nothing pleasant about chemotherapy. There's nothing pleasant about having surgery. But there they're manageable. They are manageable things. And if we talked about cancer more openly and shared what the experiences was really like more widely, I think people wouldn't be as fearful. And that's really my quest, is to get us all to talk about um, the hard parts of cancer. And of course, so much of it is the fear.
Yeah. I think we're getting there. I think it's definitely getting better.
It's getting
I
better.
will push back and say, as far as the fear, I think it really depends on the kind of cancer and the stage,
Yeah,
and perhaps also just your overall health prior to the cancer, because of course any health complications you have will make any treatment more difficult to administer. But that's the only place I would push back, because
yeah.
if you're diagnosed in stage 4,
Mm.
that's tough.
That's tough. That's
Yeah,
definitely tough. But I think that one of the hard things about cancer, one of the things that makes a cancer diagnosis so challenging, is when you first hear the words, "you've got cancer," you don't know what that means because
that's
the
true.
doctors don't know what that means. And they can't stage it until they have opened you up and seen how widespread is it. They can't type it until they have taken a sample to analyze and know what exactly it is. And because of that lack of knowledge, there's an extended period of time. It may be a few days, it may be a few months, where you don't know what your stage is and you don't know what your treatment protocol is going to be, and you assume the worst. Now, there were a couple of people I spoke with in the process of writing the book that had such rare cancers. It took more than 2 or 3 months for them to find the doctor who could answer the questions, who could come up with a protocol and tell them what their stage was. Others, their tumor seems too large to um, surgically remove initially, and so they have to go through chemotherapy or some other type of treatment to shrink the tumor before they have the surgery. So again, they don't necessarily know their prognosis until after that surgery, which could be months after their initial whispers that, oh, you've got cancer. And I think that uncertainty adds a lot to the fear and anxiety associated with the disease.
Yeah, and to your point, many people start treatment and have never actually had a biopsy. And
Right.
that always blows my mind, but it happens a lot. And again, it kind of depends on the kind of cancer. And if you're outside the US, it happens much more frequently, that you don't have a biopsy, that based on imaging and blood work, you
Hmm.
know, you're diagnosed with X, Y, or Z with really no confirmation.
No confirmation.
And
Yeah.
until you see the tissue under a microscope, I mean, how do you know for
How do
sure?
you know? How do you
Yeah.
know? Yeah.
What was your best moment in all of it?
Oh boy. I think that the best moment was actually when that surgeon took my hand and said, "Cynthia, you're going to be okay." Um, and literally, I mean, his words were, "There are two types of cancer. There's the kind of cancer that you're going to die from, and there's the kind of cancer that we can treat. And this is a cancer that we can treat, and you're going to be fine." And that that comfort and reassurance. And of course, I didn't believe him, but that was a turning point for me.
Even though
But
you didn't believe him. I love it.
even though I
Okay.
didn't believe him, it was a turning point. It took the edge off enough for me to get
Right.
through what I needed to do from there.
And Cynthia, what's one thing you wish you had known at the very beginning of your cancer journey when you first heard that news?
Yeah, I wish that I had known um, that cancer causes predictable emotional response, and that so much of the emotion one experiences with cancer is actually caused by physiological changes that drive the emotional experience. Um, Not to mention the hormonal changes of having your ovaries removed or having dexamethasone in your system or whatever. But there are changes that happen at the cellular level because there are cancer cells in your body, because treatment is killing off those cancer cells. And those physiological changes drive a lot of emotional volatility. Because we don't talk about cancer And as a society, we don't talk about mental health and emotional well-being. We certainly don't talk about the confluence of the two. And I think one of the things that was so surprising to me as I started talking to other people about cancer was the predictability and the patterns to the emotional response that people had. And of course, we're all different. We all have different DNAs, different lived experiences, different um, expectations that we put on ourselves, different ways of processing information and internalizing things and expressing ourselves. And so, even though no two of us will look the same and say the same things about our emotional experience of cancer, there's a very clear underlying pattern of emotions that happens
Sure.
during a cancer experience. And I wish that I had known going into it that that was known and predictable, and that there were tremendous support services available to people going through that emotional turmoil.
Did you get any support services?
Nope. None at all. And in fact, my surgeon and medical oncologist had co-founded a program called Women to Women that I am now a peer mentor with, which is, basically newly diagnosed gynecologic cancer patients receiving support and guidance and handholding from those of us who have been there already. And a whole host of other supportive services and information and counseling and whatnot. But the peer mentoring program, they had started this program because they knew that women needed help, but they never communicated that this program existed to me, and
No, they
and
never
it
told you?
never told me. I did not know it
What?
existed until I was looking for cancer patients to interview for the Big Ordeal. And that's when they said, "Oh, you might check with so and so who runs this program." I was like, "Well, what's this program?" And I was just blown away because I think that there are tremendous resources out there, but you have to know to ask for them. And of course, you only know to ask for them if you know that it's acceptable to ask for them, that it's predictable that you're going to need them, and that they exist. Um,
Do you think that they assumed that you already knew?
I
Think
think
that's
that they
possible?
assumed that my way of dealing with um, all things in life is to project badass and then hide my own concerns. And so I was projecting badass. My doctor called me one badass cancer patient. And that was sort of, my badge of honor that I was badass. But
Right.
that didn't mean I wasn't crying in the shower every day.
Yeah.
But because I wasn't showing my medical team my fears, I think that they didn't think I had any fears. I think that they didn't think, and part of that is just the way our medical system is designed. You know, there's a surgeon you talk to your surgery about. There's a medical oncologist you talk to your chemo about. There's a radiation oncologist you talk to your radiation about. Where is the psychosocial oncologist
Right.
as part of that team? They're rare, and some of the best cancer hospitals have a psychosocial oncology team and supportive care services, and you are required to meet with them. But if you're not required to meet with them, you don't necessarily know that they're there,
Yo, you
even if
don't
they
know they
are hidden.
exist.
You don't know that they exist. And again, nobody says this is an expected part of the process, and therefore we have these resources built in. Let's schedule you an appointment.
Yeah.
Um, and so you don't know.
So I think I know what the answer to this question is, but Cynthia, if you could only do one thing to improve healthcare in the US, so not necessarily cancer care, but just healthcare broadly, what would it be and why?
I think the most important thing would be that we incorporate mental health into physical health in all aspects of medicine, and that we go back to looking at patients as whole people as opposed to organ specific or disease specific vessels. And it's a problem because um, while we have increasingly specialized focus that allows us to be experts in so many types of care, we often lose that that human connection. And we count on our medical experts to be healers, but a big part of healing is seeing and touching and um, really hearing what a patient has to say. And I think that so much of that gets lost in the way our medical system is structured.
Yeah.
Specialists with 10 minutes per patient.
Yeah. Wow. I agree. Are you ready for the Thriver Rapid Fire?
Oh, absolutely. Hit me up.
Okay. Beach, desert, or mountains?
Well, never desert. On a normal day, I would say beach because I just love the sound of the lapping wave. But we're in the middle of a heat wave and it is bloody hot. And so I'm going to the mountains.
I love it. Beach Boys, Beatles, or Rolling Stones?
Oh, that's another tricky one, but definitely got to be the Beatles. There is a Beatles song for every emotion, every experience in life. So definitely the Beatles.
What is one word that best describes you?
Oh, hopefully insightful. I think a lot of people would say that. I'm very perceptive and I put pieces together that others don't necessarily put together and hopefully then share that in a way that's meaningful as well. So I think insightful.
And before you die, what is the last song you want to hear?
Oh, Leonard Cohen's Hallelujah. I just love that song. It gets me every time I listen to it. And, you know, not that my death is anything to be glorified, but I love that song. So,
Now,
yeah.
see, you set us up for a Beatles song, so I'm just putting it
I
out there. I was
know.
fully
Well,
prepared.
Leonard Cohen wasn't an option, and neither was Paul Simon or Eric
That's true.
Clapton.
That's true. I interviewed a 21-year-old. She is
Uh,
the youngest endometrial cancer survivor in the UK.
wow.
And she was like, yeah, I don't really know those bands. And I said, well, then you just let us know which one, pick another one. And she did. It was just like she kind of like vaguely had heard of them. And I was like,
Right.
wow,
Yeah.
vaguely had
Vaguely.
heard of
Yeah.
those three. Okay.
Yeah.
So funny. All right. How about the last meal you want to eat?
Oh, that would be my Nana's Christmas Eve supper. My goodness. I'm Sicilian by heritage, and you wouldn't know that from my name, but we used to gather around the table, 20 or more, with multi courses of fish and pasta, and my grandmother cooked it better than anybody else. So, Nana's Christmas Eve meal.
And the last person or people you want to see?
Oh, my family, my darling husband, Charlie, and my two kids, Catherine and David. I just always want to be with them. Always.
Have they given you grandkids yet?
Not yet, but I'm hoping.
Every person I know, especially women who have become a grandparent, they all say the same thing. They say, forget being a parent. Being a grandparent is amazing. It's really funny.
Yep.
How about the last words you will speak?
Oh, it'll be I love you to somebody, whoever is there. Yeah,
And
whoever is
aside
there.
from Cancer U, what's one resource that you would recommend for cancer patients and caregivers? And please tell people how they can get in touch with you and find your book.
Right. So I would highly recommend Cancer Support Community because I think that they are just terrific. But I would also recommend The Big Ordeal. And my book, The Big Ordeal, is available in bookstores everywhere. And my website, thebigordeal.com, has tremendous amount of information available for patients and caregivers. And it's free, and you don't have to buy anything. And hopefully you'll find something there that'll inspire you and maybe you'll want to buy the book because you'll want to learn more. The website has stories from patients and from caregivers. It's got insights on sort of digested science, and it's got my ramblings, my blog, as well as other information about me and other resources to use. An easy way to contact me from there, but you can always reach me at Cynthia at thebigordeal.com.
That's perfect. So we will put links to that in the show notes and the workshop notes. Cynthia, thank you so much first of all, for just coming up to the booth at ASCO and being so proactive. I mean, kudos to you. I don't
Oh,
think a
thank you.
lot of authors, regardless of what subject matter, I don't think a lot of authors realize how much the onus is on them to be
Yeah,
the salesperson for their book.
you gotta
And
be.
they, yeah, you have to be. You are the best salesperson by far. And so kudos to you for doing that, but also thank you so much for coming on and sharing your story.
Well, it's such a pleasure, Andrea. Thank you for doing this and helping to spread the word. I mean, there is so much that we do know about cancer and how to get through it. And the more we share, the more we talk about it, the more we can all learn from those who've been there. So thank you.